everyone. Thank you so much for having me today. As Edie said, my name is Jordan Hitchcock. I'm the Community Engagement Coordinator at Unidos Bridging Community. My pronouns are she, her, ella. I'm going to share a brief presentation to give you some visuals as I tell you more about Unidos and some of the work we're doing. Just one moment, let me get that queued up. All right, Edie, does everything look all right? Can you see my screen?
That looks good. Yeah, looks
Great.
good.
Alrighty, so first I'll share our mission. Unidos Bridging Community mission is to promote the integration, participation, representation, success of Latino individuals and families, and also to build bridges of support and understanding between Latinos and non-Latinos. So I'm going to go over some of our programming that we've been working on for the last several years that the organization's been in existence, as well as what we're working on now. So if you review our website, these are some of the programs that you're going to see. The Latino Abolition is something we're still doing. It is a group of community leaders and organizations. We meet once a month and talk about different ways we could support the immigrant and Latinx community. We also have the citizenship classes, which has how I was originally involved. It's a really good way to meet community members and help build up and support our neighbors as they're preparing to take the U.S. citizenship exam as part of their interview during the naturalization process. We actually just finished up our first virtual version of this class, which is really exciting. We also have historically engaged in a lot of policy advocacy. One really great example of this is the Driver's License for All Act, which just became active and in effect in January. And so now people who might not have all the documentation are able to get a legal driver's license in Oregon. Previously, obviously that was a huge barrier, preventing people from being able to drive or preventing people from being able to drive legally. And this doesn't just affect the undocumented population, but it can affect people who were victims of domestic violence or maybe natural disasters where they lost all of their social security cards, birth certificates, and things like that. So it affects a lot of our neighbors and community members. So we're really excited to see that actually taking effect now and people being able to make those appointments at the DMV. The Latinx Professionals Network is an online network that we have where we share professional development opportunities as well as job opportunities all over the state for our Latinx community. Community conversations, this is something we're doing virtually now. We will be doing about 3 per month for the next several months. Our most recent one, we actually had a doctor from the Oregon Health Authority come and speak to us about the COVID vaccine. We did a scripted interview with some facts, frequently asked questions, and then we opened up the conversation for live questions from the audience, which was really exciting. Our Latinas Together in Community program, that's a women's leadership development workshop that we have hosted several times in the last few years. That's not something we're working on right now. And then the law enforcement relations team is pretty self-explanatory, but we worked with different branches of law enforcement in McMinnville and Yamhill County to build the relationship better between the community and law enforcement. That's also not something that we have been working on lately. We've shifted a little bit of away from this specific programming since COVID. And so the next slides are going to show you more about what we've been doing. So we've been doing a lot of outreach and support at testing events throughout the county. Moving forward, we're actually going to be helping with the vaccination clinics as those expand. This is a couple of our staff members. At those events, we have helped with registration, moving traffic around, as well as distributing masks and hand sanitizer and pamphlets and information about community resources. This was at the Yamhill County Fairgrounds. This is another event we did. This was at the First Baptist Church in McMinnville. Pictured here, I'm actually on the left, and then we have a couple community volunteers that joined us for this event, and then staff members as well. This was the same type of event where we were helping people get actually the flu vaccine as well as COVID testing. It was all free, and we are also providing different types of resources and masks available. Worker educational workshops has been a newer development as part of our programming. Since COVID, we've really shifted from programming to direct services. And so this is a really good example. In the middle, you'll see pictured Jaime Flores and San Juana Aguirre, and those are two of our staff members. And then the farm workers that they were doing a workshop with that day. Moving forward, we're going to be doing some more things like workers' rights workshops. At these types of workshops, they are talking about workers' rights issues, but as well as COVID safety in the workplace. You know, as the proem mentioned in the beginning, a lot of our essential workers are Latinx people or immigrant people, and they're not getting the same support as citizens and the white community is. And so it's really important to have these conversations and make resources available and share information. One of the biggest problems we've seen throughout COVID is just the inequity in information. Not everything is available in Spanish as it is in English. There's also been a lot of disinformation, especially around the vaccine. And it's kind of, yeah, it's just a large gap between like language barrier and the information that's the credible information that's being spread. And so farm worker outreach workshops are super important, not just for COVID, but for general community resources as well. So these were some pictures that I thought were really powerful and special, just kind of show the work that our team members are doing. A lot of this work is done in the fields themselves, so go out into the vineyards and other crops. There's San Juana again. These are some more of our staff members. In addition to doing farm worker outreach, we are doing more just in the community, tabling and different types of outreach events. So this was at an apartment complex, and we've done a couple of these types of events where we just go and provide masks, hand sanitizer, or whatever community resources we have available at the time to people living in a specific area. We've been able to successfully really expand our reach and network amongst the Latinx and immigrant community in Yamhill County. Over here we have Blanca on the left, Alejandra and San Juana on the far right. This is another photo of our team members at an outreach event. So as I mentioned, the community conversations, this is something we've transitioned virtually, and we're also integrating, we're trying to integrate a lot more experts for these interviews. We found that the community really likes to hear from credible individuals about important issues. So this was one that we did recently with Dr. Dawn Mautner from OHA about the vaccine. So this is kind of a screenshot we took before the interview started. And we've done a couple other types of interviews as well. We did one, we're actually doing one next week about OHP. So the specialist, Alejandra, pictured in yellow here, is one of our staff members, and she is an enrollment and kind of a application assistance for OHP specialist. OHP is Oregon Health Plan. And so it's a type of insurance that people who might not get insurance through their work or can get some different types of coverage depending on their status and financial and all of that. But we're going to be doing a Q&A about that this week. It's all in Spanish, but if you'd like to tune in, you're always welcome. The virtual citizenship class, this was just our Spanish class. The teacher was over there on the top left, that's Mari, and these were some of her students. We had two different classes this year. We had an English class and a Spanish class. The English class had, I think, over 20 students, and the Spanish class had about 7. Almost everyone has to take the citizenship exam in English, but there are some qualifications that allow people to take in Spanish, and so that's why we have the 2 different classes. There was some stress about this over the last few months because right before the former administration left office, a change came into effect that made the difficulty of the exam and the process a lot more difficult and completely changed some of the questions. And we were trying to figure out a way to integrate the new questions with the old because both of them were still active depending on when people had filed their application for citizenship. Recently, we actually found out that that was overturned. So moving forward, community members will still be able to take the original 100 questions exam where they only actually have to answer 6 correct and they're asked up to 10. So people are excited about that. We finished that last week. We had a virtual graduation ceremony, which is really fun. This is just a picture of one of our outreach posts that talks about OHP. I didn't have available in English, but I wanted to show you, a little bit more about what that program looks like. It says, obtain the medical coverage that you need. Children 19 and below are able to receive all of the benefits of the Oregon Health Plan, regardless of their immigration status. And then you can call us to learn more about making an application for OHP. And so I have here also some ways to get involved. If you're interested in staying involved with any of those beyond today, I hope you are. So obviously we can always take donations. We're a nonprofit organization, and so that's a really important part of being able to continue this work. People sometimes do monthly donations or a one-time donation. We also are always excited to build our volunteer base. I will share some links in the chat box after this actually about where you can donate, where you can volunteer. There is a sign up on the website that asks for some basic contact information, as well as some references. Something else we're interested in is networking. So we are always making connections for bilingual service and healthcare providers, especially to utilize or include in our community conversations. And so as over the next few months, we're going to be working on providing more of these virtual community conversations over our Facebook Live platform. If you know any specialists that might be interested, we would love to have a conversation with them to organize an interview, as well as healthcare providers. As I mentioned before, we recently did the one with the doctor. It was actually very difficult to find a doctor who was available to talk about the vaccine, especially with all the work they're doing about the vaccine. And so if you know any healthcare providers that might be interested in doing that kind of expert interviews, we would appreciate that connection as well. And then we also are taking on new board members or people interested in becoming a board member with the organization. It's a pretty standard commitment in terms of board memberships. There's a once a month meeting, and the gist of it is to help advise and guide the direction of the organization. Those are the main ways you can get involved today. If you do become a volunteer, I will be in contact with you about volunteer opportunities as they arise. Our Citizenship Class program just finished, and so what that would look like is a once a week or twice a week, if you'd like, about a 90-minute commitment to participate during the class and help teach the students about the citizenship exam. Other opportunities would look like, for example, in the coming weeks, we're going to be doing some phone making and advocacy related to the new vaccine phase. So we want to make sure everyone is aware. So I don't know if you all know, but on March 29th, there's a new vaccine phase where farm workers are going to be eligible and agricultural workers for the vaccine, as well as people with underlying health conditions from age 45 to 64. And so we're expecting that a lot more of our community members may become eligible, but we've already seen a huge disparity in the actual distribution of the vaccine racially in the state and in Yamhill County. And so we're trying to help fight that disparity with education and to our community members. So we're going to be calling people, talking to them about the new vaccine phase, and making sure they have the right information and accessibility to the information and to sign up for the vaccine if they want it. So while we are, it's very important to us to encourage our community members to get vaccinated. Obviously, it's an individual's choice, and so we just want to make sure everyone has equal access to information, fighting technological gaps and accessibility as we can. So that's all I have for my visuals. So I'll put a little bit more information in the chat box. One of the links you're going to see is for the Oregon Worker Relief Fund. That's something I didn't have a picture for, so I didn't mention, but I wanted to talk about it. It's one of the programs that we've been involved with over the last, over the pandemic. It's a collaborative community fund managed by over 20 different organizations like Unidos, and it's kind of an alternative emergency assistance fund. So it's similar to the stimulus check, but it's for people who can't get the stimulus check, basically. So the Oregon Worker Relief Fund is exclusively for undocumented individuals who have been financially impacted by the pandemic. And then there's also the Oregon Quarantine Fund, which is specifically for farm workers and food supply workers. And that is not dependent on an immigration status, but it's supposed to help motivate people and provide them resources if they are exposed to the virus or need to do a quarantine. So that's been a really important project we've been a part of. And so I wanted to share a little bit of information about that and the website so you all can learn more about it if you choose to. It's been something that's been really exciting to be a part of. We have served about 20,000 community members in the state out of an approximated 100,000 people that would be eligible. So we still have a long way to go, but we've disseminated over $100 million since June, which has been really exciting. And so let me end my screen share now and I will share some links with you.